Hey guys, welcome. I hope you are all staying safe and healthy. I am Dr. Deborah and this is Dental Home Lagos. Dental Home Lagos is a platform I created to help improve the public's knowledge about oral health. Basically, what I do in this series is I explain common dental conditions in simple terms. I try as much as possible to stay away from using medical terms in order to help you understand what causes these conditions, how these conditions can be prevented, and how we as dentists, together with you, our clients or patients, treat and manage this condition. So today I will be discussing gingivitis, which is commonly known as gum disease. The word gingivitis can be broken into two: gingivitis, which simply means inflammation of the gingiva. Gingiva is the dental term for gums. So before I talk about gingivitis, I would like to show you a picture of the supporting structures of a tooth to give you a visual representation of what actually holds your tooth in place. There are four main structures that support the tooth. We have the gum, the periodontal ligaments, which are basically like tiny threads that hold the tooth in place attached to the bone. We have the bone, of course, and we have the cementum. There's a space called the periodontal pocket, which is usually present even in health. It is the space between your tooth and the gum, and usually in health it measures about 1 to 2 millimeters. So periodontal pockets become very important when we are talking about gum diseases, because in health, periodontal pockets should be between 1 to 2 millimeters. But when you start having periodontal pockets greater than 4 millimeters, it could be an indication of attachment loss, which could also be an indication of progression to periodontitis. There are various causes of gingivitis, but today I'm going to be dwelling on gingivitis caused by bacterial dental biofilm or plaque. There are various factors that modify plaque-induced gingivitis. Of the systemic factors, we have puberty, menstruation, pregnancy, we have leukemia, use of oral contraceptives, malnutrition, smoking. We also have drugs or medications like some anti-epileptic drugs or calcium channel blocker drugs, to mention just a few. So depending on whether these modifying factors are present or whether you have these conditions, and also depending on how well your body responds to infections or how strong your immune response is, the presentation and progression of gingivitis varies within individuals. Plaque is a really complex structure that is made up of bacteria, food, and a lot of other things. And if this structure or if this biofilm stays on your teeth for a long period of time, it can solidify, and in that case we would call it calculus. So calculus is basically solidified plaque. You might have noticed it around your teeth if you've not been visiting your dentist frequently for scaling and polishing. It appears like greenish or a blackish hard band around your teeth, around the neck of your teeth. So here are the main signs of gingivitis: swollen gums, red gums, and gums that bleed on slight provocation. You may also notice halitosis if you have gingivitis. So the good news is that gingivitis is usually reversible, meaning we can get your gums looking healthy if you visit your dentist at the right time. So the treatment plan is usually to get scaling and polishing done. Now, scaling and polishing is simply teeth cleaning, removing the plaque and the calculus, which we've identified as the cause of gingivitis. However, like I mentioned earlier, plaque-induced gingivitis is just one form of gingivitis. There are other causes of gingivitis. We have bacterial infection, viral infections, and so on. So once your dentist identifies the cause of your gingivitis to be plaque-induced, the first step is to get scaling and polishing done. We usually recommend that you get scaling and polishing done twice in a year or every 6 months. Apart from getting scaling and polishing done regularly at your dentist, it is also important for you to have proper oral home care, and I'm going to be giving you some tips to ensure that you have good oral hygiene practices. It is important that you use the right equipment to brush your teeth. We do not advocate that you use hard bristle toothbrushes because they can be detrimental to your gum and lead to wearing of your gum away from your teeth, which can lead to sensitivity in the nearest future. So we advise that you stick with soft or medium bristle toothbrush, soft usually. The other thing is to make sure that you use a fluoridated toothpaste, basically toothpaste that contains fluoride, and also we advise that you use a dental floss. Now, apart from getting the right equipment, like getting the right toothbrush, the right bristle toothbrush, it is important that you use the right technique in brushing. I'm going to insert a link to a video showing the right technique you should be using for brushing. So it's not the aggressive technique. There's actually a specific technique that your dentist or your dental hygienist would show you. Please make sure you change your toothbrush at least every 3 months, or when you notice that the toothbrush bristles are flayed. So thank you very much for watching. I've tried as much as possible in this video to explain what gingivitis is, to explain what causes gingivitis, how we treat gingivitis, and things you can do at home to also prevent gingivitis, to help you to ensure that you maintain a good oral health. So if you have any questions, please do not hesitate to ask me in the comment sections below, or send a direct message to us on Instagram at Dental Home Lagos, and I'll be sure to answer your questions. So thank you. See you next time. Stay safe. Peace.